Hi, everybody. Happy Wednesday. Welcome to another installment of the Supportive Housing Net Workshops. My name is Tiara Labrada, Senior Policy Analyst with the Supportive Housing Network of New York. Today, we are doing a CAPS 2.0 demonstration with the Coordinated Assessment and Placement team. They will join us to do a demo of some updates, to highlight some upcoming enhancements, and to answer some technical questions related to the system. I'm not going to take up too much time with introductions, so I will have Craig Retchless and Robin Pagliuco join me on screen so that we can go ahead and get started. All right, I'm going to pass it off to you with just one housekeeping note. Please put your questions in the Q&A. If you look at the bottom of your Zoom screen, you will see that there are several different buttons there. One is for the chat, another is for the Q&A. Please put your questions in the Q&A so that we can answer them offline if we need to, and it's easier for Craig and Robin to moderate and be able to answer your questions. All right, thank you guys. I'm passing it off to you, Craig and Robin.
Okay, thanks, Tiara. Hi, I'm Craig Retchless. I'm an Assistant Deputy Commissioner at HRA, and I oversee the Coordinated Entry team and the PACT unit that does the reviews the supportive housing applications. And so I'll hand off to Robin for her introductions, and then we'll get into it.
All right, good morning, everyone. My name is Robin Pagliuco. I'm the Director of Coordinated Entry, which, as you've just heard, is one of the units that Craig oversees. And I will not be doing this demo, but I will be doing a little backup monitoring the Q&A. So if you have any questions, and please enjoy. Take it away, Craig.
Yeah, thank you, Robin. So like Tiara said, if you could put your questions in the Q&A, or if you do a chat comment, Robin will be monitoring that, and they will let you know. And also we'll try to weave it into the presentation. So so basically what we're doing today is I am going to be demoing certain parts of the system from the housing provider perspective. So this really is from, you know, agencies that have supportive housing contracts like New York 3, Pop A contracts, and showing you the new coordinated assessment and placement system and what you can do. And we'll do some helpful hints, and we'll also try to point you in the direction of good information so that you can get up to speed on the new system. And I do want to say that I appreciate everyone who is joining the presentation, and glad that you're engaged with the CAP system and the coordinated entry team that Robin so wonderfully leads. So in addition to the demo, we'll also be talking a little bit about future enhancements. And we're also going to have Robin talk a little bit about housing inventory efforts that are ongoing. And then, of course, like we could maybe have some time for live Q&A. Questions and answers, like people could let us know. So, all right, so what I'll do is I'm gonna share my screen, and I'm hoping that everything goes well technically and nothing catastrophic happens here. So anyway, here we go. Going to share my screen. All right, there we go. So what you should be seeing right now is I'm in the CAP system. I'm in as a housing provider. I'm impersonating a staff person at Canva. And this will not have any client information, and it's not like actual information on the program. Like, this is not really what Canva sees. This is a training environment. So I did want to give that little disclosure. But as you can see, this is my what we call the dashboard. And so the first thing I'll show you is that this little, what I call these hamburger patties up here in the corner, you can reduce, like if you're a left navigation person, you can go through all the components of the system this way, or you can reduce this and just use your icons, and they're separated by survey application, vacancy control, some stats down here, and announcements that are, and you'll see that the announcement here really points you to like all of the training materials that we have. Okay, so I am going to expand this again so you can see the main components of the system. Now, survey application, that's if you're going to be doing a coordinated assessment survey on a client. That's a lot of, if you have shelter programs, you're doing surveys on clients. We're not going to be going over that. We're not going to be going over the application either. That would take a lot of time. But instead, we are going over the vacancy control system, and we are focusing on the unit roster. We are focusing on the referral roster and the tenant roster. And then I'm going to do a quick thing on legacy TAD. TAD stands for turnaround document, and that is the monthly reporting of move-ins and move-outs into the different supportive housing contracts that your agency has. And then I did want to also say that if you are like a sysadmin in our system, you also have access to user security. And look at this neat button here. It says add new users. And so a lot of times people will contact you know, our teams at HRA around adding new users to the system. And if you know somebody at your agency that is a system administrator, they can actually add you to the system. You don't even need to involve HRA in that. So that's just, I wanted to highlight that. And then information. This is a wonderful thing to get announcements. And so this is an example of an announcement. This is the CAPS announcement. So we launched October 26th, and I'm highlighting this announcement because if you're experiencing technical difficulties, this gives you some you know, guidance on like, here is the email that you can contact the HRA CAS support, and also if you're having access issues in terms of accessing the info or like password issues, then you would be going to our HRA's security administration. That's a separate email. It's okay if you email HRA CAS support, they will put you in touch with MIS security as well. And then I did want to highlight this website because this is the CAPS website on the Continuum of Care or CAPS page on the Continuum of Care website. And so you can go and get a lot of materials on CAPS, and a lot of our training materials are posted there. So if you don't have access to the system, you can still know about CAPS and access those documents, okay? Just wanted to highlight that. Okay, and then of course, there under information, there are trainings. And so there are very, very comprehensive PowerPoint trainings on the dashboard. You will get to know everything about the system and what the icons mean, an orientation to the survey, an orientation to the application. And then the CAPS modules, you know, like if you don't know how to add a user, you could go to the module 1 for user security. Then this is kind of an overview of CAPS functionality, a way to do site requests in the system, you know, how to manage your VCS rosters, which I'm going to be going over. We're not going to be getting into TADS, but there is a module on it, and then some other helpful guides and training materials for you know, submitting applications when you're doing that. Okay, so I am gonna, you know, I'm gonna reduce, so I can go into my vacancy control system, or I can go here on my dashboard, but I'll go here. I'm a left navigation guy. So then I'm gonna go into my unit roster. All right, so as you can see, you know, if I look here, I have to, the first thing I need to do is I need to select a site. And so today I'm selecting Dumont Ave. And then what I can do is I can select all my contracts, or I can select my community units. This is what the makeup of the unit roster is. So the guidance here is that we would really like supportive housing providers to go through each of their unit rosters to ensure that they are accurate according to what you feel should be on your unit roster. Now, a lot of agencies have done this already in the system. A lot of people were very proactive. If you haven't done that already, it's okay. Make a point of scheduling yourself to do this, because it's really important that you have the unit rosters correct before you do anything else in the system. So that has been our general guidance on this. So how about I just, for training and demo purposes, I'm gonna focus on the New York 3 Pop A units that are in this program, Dumont Ave. And you'll see the unit roster says 3 out of 3. So I know I'm gonna have 3 units that are Pop A. And I have to scroll down to see what those units are and what the unit roster looks like for the New York 3 Pop A contract, right? So a little bit of orientation to this is that, you know, like if something is hidden, you can just scroll things over to see more information, right? So that you can see the primary service agreement on this roster. So these are the Pop A units. It gives the contracting agency, and so DOHMH, these are Pop A City. There are Pop A State as well, but these are Pop A City. Then the unit name, I'm gonna be going over these in detail, but just to give you a little bit of an orientation to like what you can do here. You can pin things with this. You can, you know, sort. You can put 2T, and then that makes it just so you can focus on that one unit. That comes in handy when you have a long list of units that you're going to be working with. All right, so and you can do that in any one of these boxes. You can sort your lists, and so that is a great enhancement in the system, so that you can you know, work on a specific unit. All right, so what I'm going to do now is this is the action column. So these 3 red dots gives me some options to take action. And so what I'm going to be showing today is the edit unit function. So I have unit 2T, and I'm going to click edit unit. And then what I can do is I can come up here and edit these details. I'm going to go over those in a minute, but I want to show you something else first. All right. So so as you can see, there are different unit statuses here. So we have an online. This says occupied. So if you go, and this is why we emphasize starting with your unit rosters, if you go and edit this unit, do you guys see the info? It says can't modify the unit. And so that is just kind of letting you know that once you move a client into the unit, the system doesn't allow you to edit unit details. We are working on that. That is part of a future enhancement, so that there are certain unit details you will be able to edit in the future. Stay tuned, okay? But for our purposes, let's go over, for our training purposes, let's go over something that we can work on, and that would be a unit that is online and not occupied. So again, just orientation is that you're in this site, you're working on your POP A units, and so the unit here is unit 2T. There is also, so this is, there's no naming convention, but what we're saying to, or what we're advising is that, you know, you come up with a naming convention that makes sense for you and that you're able to identify the unit. It's usually the apartment number, right? So, you know, that is something. So there is a 2T in this, in Dumont Ave. These are the contracting agencies. So it can be, if it was POP A state, this would be OMH, not DOHMH, but we know they're POP A city. So that's DOHMH, right? So, so I can make changes to that. I can make changes to the unit status. So online and means that it's not occupied and that it's ready for referrals. If I made it offline, I would then get these fields, and then I would have to select an offline reason. So these are the reasons that you may select. There is an other kind of catch-all, but there's a lot of other, these are good. So a lot of times it is probably renovations, repairs needed. When you have a move out, you can give an expected date of when you feel that the apartment will be available. But what I'm gonna do is I'm gonna keep this online for our training purposes later. And then studio, these are the different unit types. And so this makes a difference in terms of, you know, especially with the family units, this makes a big difference. And then, you know, whether there are, you know, like in suites, there may be some shared facilities, right? And then unit features, you would have this is very important because you're communicating to potentially like referring agencies like HRA placement and HASA, who would be referring to your New York 3 POP H beds, what type of unit and what kind of features are in it. And this would have an impact on who they're going to send you as a referral. And then so I can make changes to this. I can make this private bathroom no. And as you can see, it shows up here. So we'll switch that back. And then these are the rental subsidies. And what I like to say here is that these are not, these are project-based rental subsidies that are attached to the unit. If a client is coming to you with Section 8, that is not what we're interested in, because if the client leaves, they're leaving with their Section 8 clearly. But you can make changes to this. You can unclick this and make it none, and then you can see none shows up here. So we'll keep it Section 8 HPD, and so there must be some project-based Section 8 in that. And then once I make all the changes, I can save it, and then it'll be reflected down in my roster. So I'll save that. And so I successfully saved those details. All right. So that is, so really our guidance, again, not to sound like a broken record, but our guidance is to, you know, go through each and every one of your programs. And what you would be doing is you would be reviewing every single roster and adding the unit roster details on the unit. This is a big advancement in our system because we didn't have the ability to capture this information in the old system. So people who are familiar with the old system, you know that it was limited in this regard. Okay, so that is all I was going to show on the unit roster. I guess what I'll ask if any questions have come up that maybe we want to talk about now regarding the unit roster, or shall I move on?
I would like to address some questions to the group that have been answering in the chat as fast as I can. So please apologize if I'm a little slow.
Okay.
So if you need to make changes to your unit roster, right? If your contracts are not correct, if you're missing a contract, if the number is not correct, if you are a DHS SRO provider, meaning you have Gen Pop units, you communicate with the vacancy team about your programs, you submit the roster every month, you need to reach out to them directly to make any changes with your contract. They will work with us, my coordinated entry team, and we will make those changes in the system. If you have other contracts that you need to make adjustments to, community units, New York 3, SMI, please reach out directly to the coordinated entry team. Now, how do I get in touch with you? How do I do that? You could always go to HRA CAS support, right? All of those emails get funneled to the appropriate person on the coordinated entry team. You also, every time you submit a TAD, one of the monthly reports that Craig was talking about earlier, you have the name of your TAD liaison plus their email address in that communication, right? So that is that's your other first line of contact to reach out, communicate, and then ask about changing your contracts, and we can make those adjustments for you. So those are sort of the general big questions that I'm getting, and then I am trying to answer the specifics as quickly as possible. But again, if you do have a really specific question, like I can't move Susie Q into Unit 4A, that's best sent to HRA CAS support, because that's not something that I can answer right now in the Q&A. So thank you.
Great. Thanks, Robin. That's great. And it kind of reminded me of something that, you know, like if you, like, let's say the Pop G units, there are 33 units that we have in our system that are contracted for the population G. This is a family population under the New York 3 agreement. What we would do is, if you submitted to us the coordinated entry, when I say us, I mean HRA, the coordinated entry team, you know, Robin's team, that what we would do is, if there were any changes like to your New York contracts, we would reach out to the appropriate contract agency and verify those changes. So that's just a kind of helpful hint that, like, if you're off, we do want to know if according to your records we're off, but we're also going to be reaching out to the appropriate contract agency and verifying that. Okay, so we will be happy to facilitate getting all of that. If there is a discrepancy in your records and what we have in the system, we're happy to address those things.
Craig,
Okay.
just one more quick thing.
Yeah.
Or perhaps, you know, I'll save it until you get to the tenant roster because it's more appropriate for there. So I just muted myself, sorry.
Okay, no problem. Okay, so I'm gonna move on because we are at 11:30. So, and I hope people are learning something. A lot of this is the happy path, and if you have more complicated issues, of course, you can reach out to HRA CAS support or to your TAD liaison, who is on Robin's team, if you know who that is. So it's just to name the staff on Robin's team: Crystal Ruff, Kenya Maldonado, and Reina Machado. And they have been really great in following up with people and working through even training issues in the system, but also like a lot of good questions coming from providers. Okay, so let's go on to the referral roster. Okay, so I'm gonna just reduce that. So, okay, so the first thing I need to do is, right, I need to select the program. So I'm gonna select Dumont again, my go-to program. I hit go, and so what am I seeing? First thing I'm seeing is pending. So what is a referral roster? You might be asking. Well, that is a roster of referrals in the system that have been sent to you by either HRA placement or HASA, and for New York 3 Pop I providers, there are referrals that come through the system from ACS. So these are applications of clients, approved applications for the population that you have contracts for. So we call them placement agencies or placement entities. So and you can see here, so this would be the client information, last name, first name. Of course, in the training environment, it is just a number. And then you can see like eligibility, the prioritization, which is the SVA on these individuals, and head of household for the family units. And then you can see more information here, where you can see who referred. So, people are familiar that Maria Rodriguez does a lot of referrals in the system for the family units. Fuad Razaloff, and both Maria and Fuad are on the HRA placement, referral and placement team. And so Fuad does a lot of the individual referrals. So I wanted to show you a few things on your referral roster. So you can see here that the status is overdue. It's okay. There are some overdue because maybe you haven't received like kind of a recent referral. These are leftovers in the old system that got migrated over to the new system. And there has been no follow up on the outcome of the referral. Okay, and so let me show you what we can do. So in your pending list, you can go to the action column. The 3 dots gives you some options on how to update the outcomes. I'm going to focus on the update the outcomes. You are able to put in interview scheduling details in the system, but I would closely coordinate that still with your placement agency, whether that be HASA or HRA placement. But basically, if you have scheduled an interview with a client and it's taken place and you want to provide the outcome of that interview, you would select update outcome. And then you would come to this screen. So
Craig,
you can.
I'm sorry to interrupt.
Sure.
I wanted to ask if you could clarify something. As you're talking about the communication and scheduling the interview, can you talk a little bit about communication around when you have vacancies and when to expect referrals? Because that's coming up a lot in the Q&A.
Okay, so right now we're in transition between let's take HRA referral and placement team as the example, not HASA. So you're letting them know still through email that you have a vacancy. So we're in transition to the new system, but you can also, when a unit comes online, and if it is a tracked unit in our system and it is under vacancy control, it will come to that team, and they will be reaching out to you to verify vacancy information with you. Not all the units are under vacancy control with HRA placement, but you know, if you are using HRA placement and they, you know, for like New York 3 Pop G, you know that you need to let HRA placement know when you have a vacancy. You can note it here in the system, but you're also reaching out to the staff there. I hope that answers the question.
Yeah, that was exactly the question.
Okay.
Because there's a lot of questions that are coming up. Like, I have a vacancy. Where's my referral?
Right.
It doesn't magically come in the system, right? We're still in that period of action on your part, reaching out, communicating with the referral source, and then also to clarify that if you just added a COC funded program to the system, at this time, there's no referral mechanism for exclusively COC funded programs. So please, you know, stay in communication with who you usually get your referrals from. And this is something that obviously CAPS is working to address in time.
Yes, and we appreciate your patience. We are a little bit flying the plane while we're building it. This has been how we've been operating because we do want to have, you know, some of the functionality in the system, get people used to the system. So not everything, you know, operationally has been required in the system. So if you used to get referrals from HRA placement for specific units, you should still continue to communicate with those folks around your vacancies. Don't assume that when you say, like, put a unit offline in the CAP system, that automatically is going to go to HRA placement and they're going to know that. They will be able to see it in the system, but there's no kind of notification of that, right? And so it's still better to be communicating in email at this point in time while we're transitioning and people are learning the new system. We're not quite there, but we will be there. You know, I am optimistic very shortly. Okay, so back to the referral roster. And so I went into an actual referral. You'll see that this gives me, at the top, gives me some referral details, like where it came from. So this one came from the single shelter placement office, still under DHS, but it's really HRA placement. You know, this referral came from Maria Rodriguez. You saw that when we had the full view of the roster, the referral roster. So I'm in this particular client, and so I want to communicate what happened on the interview. So the first thing I can say is that the interview happened. So it happened January 4th of this year at 9 a.m. And maybe that's when it was scheduled, but maybe the person didn't show. So maybe you're saying, no, the interview wasn't conducted, right? And then you have reasons that you can enter here. Maybe the interview was canceled or it was no call, no show. So this is good because in the old system, we didn't have as sophisticated an interview outcome. And of course, you can enter comments here. But I'm not going to say that the interview is no. I'm going to say the interview was yes. All right. And then the interview outcome, you can see here, I can accept the client. I can put pending here, and that will, I'm not going to go through all of these, you know, how to do all of these outcomes. But I'm going to do an accepted. But just to show you, you can say that the client didn't accept your housing. Sometimes the client rejects you. And then this is when the housing provider does not accept the client. So you're rejecting the client, and then you give the reasons. I'm going to go the happy path and say accepted. Okay, so what is the placement outcome? Am I pending approval, like pending like leasing approval, or am I going to go ahead and move this client in? why don't I go ahead and move the client in? So this is really great because in this system, you can move in a tenant in many different areas of the system, but you do need to know what, that you have the accurate information, right? So this is, if you remember, this is a POP-G client. So I definitely want to move them into something on my unit roster that is a POP-G unit, the unit that they moved into, right? So if I assigned the wrong unit name and the wrong contract in my unit roster and then move the client in, I'm not going to be able to correct that right now. All right, so I'm going to say that the client moved in. Let's say they moved in a couple weeks after the interview took place. And then for POP-G, I happen to know that 1F, see, if you haven't done anything in your unit roster, you're not going to get all these are the unit names that you entered. So if they're not in there already and you haven't entered them, you're not going to get this wonderful drop down of selecting the unit. I happen to know that 1F is a POP-G unit. So I'm going to select that to move the client in. I'm going to say 215. And then income source, we'll say SSI. And then we will transmit. Okay, I did. Oh, that's interesting. Okay. So this is, I did some prep for this. This is saying that the eligibility of the client does not match the unit profile I selected. Do I want to continue? So maybe I didn't write down the right POP-G unit. We'll take a look at that. So I'm just going to say no to this because I don't want to move in a client to the wrong unit, right? So I'll say no. So that is going to be, then I'm not going to be doing a move in here. Why don't I try, I'm going to try one other unit. Let me see if, but that would be a good, catch. I thought that this was also a POP-G unit. Let's see if it allows me to do that. No. Okay. All right. So I'm going to move on from there, but what it was basically the system is telling me that I'm not, it's warning me that the eligibility of the client does not match the unit roster, what I had for the unit roster. All right, so I'm going to move on to you get a sense of how you can do your referral roster. You can either move them in, you can update the outcome, and then once you complete it and transmit it, say the interview didn't happen, it will then move over to the completed, and you'll be able to find the client and what outcomes, the details of your outcomes will be in this list here, right? So it'll say like what was the outcome of the, some of these have been administratively closed as well. Here we go. Okay, so any questions on the referral roster? So you get referrals from like HRA placement, HASA, and you will eventually need to clear your referral roster before you can submit your TADs. Right now, there's no rule on that. You can submit your TAD and still have overdue or outstanding referrals on that roster. So we're in a grace period right now, like I've been saying in terms of the system and rules in the system. All right. Now I would like to go to the tenant roster. I'm going to use the same program for continuity. All right. And so I selected the program, I hit go, and then this gives me my tenants. And so what I can do here is this is really good. Like it shows me the tenants, and with these being this you know, kind of orangey color, it says that it's kind of letting you know, the system's letting you know you need to assign the tenant to a unit. And so a lot of this information, it was migrated over from the old system. So this client information here. And so, you know, I would be able to action, you know, moving the client and what we're calling linking the client to a unit, right? But before I get into all of that, I did want to show you there are other parts of this tenant roster. So these are the tenants that are at the top of the roster, and then you can start to see some of the unit information. So it's a combination of the tenants. And so you can see that this unit here, unit 1A, is occupied. It's a POP-G unit. And so it has the client's information, and this client has already been linked to this unit. It's occupied. And so everything's done on this unit until you need to move the client out, right? The client moved in, you've linked them to the unit, and then there's no action that you need to take on this unless they move out of this unit. So I think that that is also clear. All right. So you can see there's a lot of, it gives you the type of unit. And I did think that, yeah. Yeah. All right. So, so in the tenant roster, why don't we go ahead and I'll show you how to link a client. So I'm going to assign this tenant to a unit. So you need to know like what the eligibility of the client and what the unit is in terms of the contract. So I'm going to say okay. It's asking me if I'm sure the system. I will say okay. All right. So that client was successfully linked to unit 1F. And so the way I can see that is I can move down my tenant roster. And so here you go. Now 1F is occupied, and here is the tenant information. So you see there's another way to link clients to the tenants and get them into the right unit. All right. So you can also do, let's see here. So you can also do a move-in of a tenant from this roster as well. So you know the client who is in 1L. It's a New York 3 POP-G unit. There's more than one way to skin a cat, right? So I'm going to move in this way. And you know, I may not have a referral on the client. The best way to do it is if I've received a referral, that I would move them in from the referral. But if I didn't receive it on the referral roster, then what I would do is I would, I'm not going to go in, I'm not going to actually do this client search, but I would enter the client first name, last name, HRA ID number, and the referral date. All of this information is on the client's determination letter. You would hit search, and then the system is going to search CATs, find the client, and then you will have the information that you need to move in the client. So I just wanted to show you that way of moving in a client on your tenant roster. So I'm going to exit this. And I'm going to show you one other way, because a lot of people have also community units. And it's a little bit different in terms of moving someone into a community unit. They may not have a supportive housing application because it's a community unit. And so you are able to move in a tenant on the community units, only this is not going to search for an application in the CAP system. This would just be noting that the unit is occupied, and so you're giving basic demographic information on the client, and then it would populate in the system. Okay. So that is all I was going to show on the tenant roster, but if you have a lot of this orange color for your tenants, that means that you haven't assigned them. And so that, you know, I showed you how you can assign them to the unit. And I also showed you a few ways that you could move clients into the appropriate unit. But as I'm going to say it one more time, make sure your unit rosters are correct. You got the right name, the right contract to the right apartment, and that. So are there more questions regarding any of the rosters that I've reviewed so far?
Sorry, I was on mute. I have a couple things that I wanted to share with the group. Number
Sure.
one, if you have questions, please put them in the Q&A, not in the chat, because that's where I am. So for all y'all with the questions in the chat, please put them in the Q&A. Second is with the tenant roster, Craig, can you talk a little bit about tenants with applications prior to 2013 and some of the challenges that folks are having adding those clients? Because that's a lot of questions, and I did say that we were going to address that live.
Yeah, so right now there is we're having an issue with what we want. We only migrated over data on clients that go back to 2013. And so that sometimes creates an issue in terms of finding the client. So if you know you have an application on a client and an approval, and it was prior to that, the system is not going to find the client in that client search that I was showing you. It won't impact if they're on your tenant roster now. As you can see, there is information on these clients in the system that were migrated over, these clients that have not been assigned to a unit yet. But for those new clients that you may want to move in, maybe for whatever reason, they weren't migrated over, or things changed and you're now addressing changes that needed to be made in your TAD process. So that can be a little bit tricky in the new system. Is that what you were going for, Robin, to have me explain that?
Yes.
Okay, all right. And you know, we are working on some solutions for that in the system as well. And so what I would say there is stay tuned. This is one of those things with migrating from one, you know, kind of very old, large system to an even a brand new and even larger system. And so we do have some unintended consequences of those kind of decisions. Are there any other questions you wanted me to address, Robin?
I think that we covered the big ones, right? So a lot of the big questions, I'm sorry if you mentioned this Q&A has really been kicking my butt, I got to be honest. So
Okay.
I may have missed some of the things that you were saying.
Okay.
a lot of the questions are about, I can't update an occupied unit. I moved somebody into the wrong unit, right?
Yes.
And so I'm sure you have mentioned this, but I'm just going to reiterate, please be patient. We are waiting on
Yes.
fixes. And when in doubt, reach out to your TAD liaison.
Yes.
How do I find out who my TAD liaison is? Should be in the email that you get reminding you about the TAD. If you don't know who that is, or you're not getting those emails, please talk to other people in your agency, because likely they're the ones that are getting those emails. So yeah, I just want to really encourage folks to be proactive about figuring out who the users are in their own agency, because if you don't think that your agency is doing all this work, likely they are, right? And they're very engaged with folks on my team. And so I would encourage a lot of communication, especially because this is a new system, right? Sharing information. We do a lot of walkthroughs with agencies one-on-one. So please, communicate with the people on your team that might be doing this exact same work.
Yeah, that's a really great tip for the providers. Yeah, so we have recognized that the inability to edit a unit once it's occupied is rather limiting. And so we are really, as we speak, there are people working on that so that we are able to have that functionality, and that you will be able to change certain fields in the unit roster when it's occupied. And then also the coordinated entry staff will have even broader permissions to help you correct other fields in the system. So stay tuned. It is coming very soon. And I would say that this is not going to be the last demo that we do either. We will do more demos in the future to show and maybe even be targeted around like the TAD process, and then even issues that people are experiencing, and we could do some, kind of problem solving. Right now, we're doing it agency by agency as people contact us, and we're doing some large groups to kind of hone in on those things, and to say it's okay. It's okay if it's not correct right now. And address concerns that you have about it not being correct in the system. It's okay. All right, so the last thing I was going to show is that there is a new report under vacancy control system that is called Legacy TAD. And so I can't actually show you the report, but I think that people will know what I'm talking about. These are the, so if I were to do Dumont, see, there are two Dumonts. One was for the New York 3 Pop G, and one was for the New York 3 Pop A. So you may remember, that you had these TADs, right? So you can go back and look at, who was in those units. So, you can go back to even, let's say, September of this year prior to the CAPS launch. And you can see what, you submitted. So the submitted TAD is what you submitted. And then the verified TAD is what, that is the final TAD that has been reviewed by the coordinated entry team. They've reviewed what you submitted in terms of move in, move out, or whether you didn't really even move in and move out. A lot of times that is the verified TAD. So you can go in and look at these things. And so you would select those fields and then you would hit submit here. I'm not going to do that here because I'm not sure if the training system it will also not show client information. So I just want to make sure I'm not showing any client information. But I thought that would be helpful for folks to know because maybe you have a question about, like, you know, the tenants on your tenant roster, you know, that kind of thing, or, you know, what was in the old system and you were used to the old system. So this would be a way to do some forensic on your part to see what was in the what was then the PAC system, which is now the CAP system. I feel like this would be a helpful tool for you. All right. So that would conclude what I was going to cover in terms of the vacancy control. Again, right now for the COC referrals, stay tuned on that. We do have a workflow in the system, but we're not quite ready to have an operational component behind that. And then again, with the scheduler, I would encourage people to, you know, use the channels of communication you used to have with your placement agencies to make sure that you're scheduling the clients appropriately and not just assuming if you use the scheduler in the system. It is active in the system, but I'm just saying that it may not translate into like a notification of staff in the of the placement entities. That is coming soon as well. The biggest thing that I would say about the scheduler is that right now, you know, HRA placement, referral and placement team, they are continuing to use the manifest sheets for, you know, scheduling interviews from the shelter system. And we are working towards, you know, having everything in the system. We're not there yet. So right now, you'll still be getting referrals in the system, but they will also be still continuing to contact you and doing, you know, they'll do referrals in the system. They'll encourage you to do the interview outcomes in the system, but you know, there's still scheduling that is happening using the manifest so that until everyone is up to speed and trained fully on this component. So there you have it. We covered the unit roster, and just as a reminder, you can see here, you select the program, and then you can select, you know, the contract, and then you can see your units. If you don't have, this is a fairly completed unit roster. You know, it has the unit name, it has the unit type, all of these things, whether it's occupied or online, those kind of things. So this is an example of a unit roster that is almost nearly complete. We covered the referral roster, which is, as I went over, that is the referrals of the individual or head of households that the application package that you can do updates to the referral. You can give interview outcomes. You can even move people in from this roster. And then we did a kind of high level overview of your tenant roster and the components of that you can link tenants to different units. And you can also do move-in functions on this roster using, you know, like you see like apartment 1R is PUBG, and you know the client information. And I went over that with you as well. So that would conclude the demo. Are there any other questions that folks wanted to ask, or Robin, is there
Craig,
anything?
Before you open it up, there's a lot of questions about upcoming trainings, right? Which you did speak to, that we do these walkthroughs often. We do individual walkthroughs with housing providers. There's been a lot of questions about training for completing the survey and the application.
Mm,
So that's been a big request, as well as how are we gonna know when these changes are in the system for us to be able to update occupied units, move the tenants in.
yeah.
You will know. We will make an announcement. We'll make an announcement
Yeah.
through the system. There'll likely
Yeah.
be an email blast. I don't know, there might
Yeah.
be balloons or clowns. I'm not sure, but you will know.
Yeah. We will do a full court press on announcements when those changes can be made in the system.
As well
It's
as
a
scheduling trainings on how to make those corrections, how to
yes.
get your rosters in tip-top shape. Absolutely.
Right. So the way this works is, as I was saying, there is a development team that is working on these enhancements to the system. And then what we would do is we would have a formal announcement in the system, and you would be able to see that. I think that, what you would see, you would get like a little notification here on this bell here. And then also you could be checking, but we would also do an email out to our users, our housing provider users, to say, hey, this has been done in the system, and this is a new enhancement. So you will be notified through the system. We'll probably also do a notification through the COC, and the CAPS committee will just be looking for a number of different ways. We use CUC vacancy control announcements as a way of getting the word out to supportive housing providers. We use the network. We use Corporation for Supportive Housing. So we will do a full court, like I said, a full court press on getting that information out to you when the changes have been made in the system. In addition to what Robin's team is doing, which is communicating directly to individual agencies around their issues and giving them a heads up on what they can do and when they can do it. So in terms of the survey and application training, I would say before we went live with CAPS, we were doing some remote live trainings like I'm doing right here, like doing a demo. But absent that, if you go to the application PowerPoint, you can also use the Coordinated Assessment Survey Guide. These are wonderful written training materials in order to learn more about the utility and the functionality of the Coordinated Assessment Survey and the supportive housing application. They are thorough, they are comprehensive. Like I said, the dashboard PowerPoint will give you a full orientation to anything that might be on your dashboard and what it means. It gives an explanation of all the little icons and everything. And then, descriptions. If you don't remember, like, what is that referral roster and that kind of thing. And then the application PowerPoint really does get into the specifics of the survey and the new, there is definitely changes to the application and how you go about completing it. We think we built in a lot of efficiencies, but we also understand that it's probably an adjustment because you were used to the old application. So, again, if you have questions, you can submit them to HRA CAS support. The way I would think about it is if it's supportive housing placement questions in terms of like using the CAP system, to report your move-ins and move-outs, that would go to Robin's team. If it was an application question or even a survey question, that would go to Alethia's team, the PACT unit. So you could reach out if you have those contacts. All right. Are there more questions? Did we trigger any more questions?
Nope.
No, not right now. Okay. All right, great. We want to thank the network, Tiara, Emily, Joelle. We really do thank you for providing us the opportunity to demonstrate the new system and to go over these things. We'll be, the network is a very active member of the CAPS committee. And so they are also a good person to, kind of, if there are certain needs that you have, you can certainly reach out to them on those things, and they communicate it to us as well. But I just wanted to thank you guys for providing us this opportunity to help housing providers make the adjustment to the new system. And we're really hoping that this is helpful to them to really start to utilize this system to its fullest capacity.
Thank you so much, Craig. Thank you so much, Robin, for joining us again. Just a quick note, we will have this presentation posted on our website at some point in the next couple of days, so you can review it and share it with your team. Craig, yes, thank you for that note. We are, an active member of the CAPS committee, also an active member of the Continuum of Care. So if you have more detailed questions or issues with the system, please shoot us an email, let us know. We'll do our best to elevate that to Craig and Robin for you and for the other folks. Yeah, thank you so much again. Super informative, very helpful. Thank you for all the work that you are doing to make the CAPS program user-friendly and help to expedite the process of moving folks from shelter into permanent supportive housing. So I appreciate all of your work. Yeah, and look, we're giving people 20 minutes of their time back. So
yeah, and so we'll get into more detail on some of the other functionality in future presentations. We'll reach out to the network when we get the new enhancements. That'll be a great way to, get the word out on what you can, some of the new functionality that will be put into the system. And, we're really looking forward to it. And again, I want to thank everyone for your engagement. Some providers have really, done such a great job getting into the system, learning it. And this is all during a pandemic. And if I had a choice of launching a system in a pandemic or not, I don't think I would, make that choice. But I am impressed with the resiliency that people have demonstrated in, learning this brand new system. And I do want to call out Robin and her team. They have been doing a wonderful job, I think, with individual agencies. And you can always reach out to us. We're open for feedback, and we're open for direct assistance, because sometimes there are issues that a specific agency is having. You can't really go over it in a big forum like this. And that's why we schedule those individual agency, kind of like mini workshops, so that people can understand the system. So I do appreciate all of that work being done and everyone being engaged that way. I really appreciate it.
thank you so much.
Yeah.
All right. Bye, everybody. Enjoy the rest of your
Bye.
afternoon as you can.
Have a wonderful week. Stay
Yeah.
safe, healthy.
Thank you, everyone. Bye.
Bye-bye.